Hello, and welcome to the second session on breastfeeding. This session will cover the basics for successful breastfeeding, breastfeeding when the baby awakes and upon request, initiating breastfeeding and latching on, narrative sucking, is the baby feeding well, expressing milk manually. It is important that the partner also learn the basics of breastfeeding, how it works, and how to overcome the difficulties. It is an important and an essential source of support for successful breastfeeding. It positively influences the decision to breastfeed and the duration of breastfeeding. It's important to get involved in every step. At the hospital, the partner's role could be to limit visits and let the mother and the baby learn how to properly breastfeed. At home, the partner can show his support by getting up with her at night, sitting down with her, making her comfortable, talking to her, and encouraging her. Breastfeeding will not interfere with the bonding between you and the baby. Here are some ways to help bond with your baby. Their voice can be soothing for the baby when they sing or speak. Napping on their chest, a great place for the baby. Bathing the baby. Playing with the baby. Changing the baby's diaper. When waking, during the first few weeks. When waking, present the breast to the baby whenever it wakes up. The baby and the mother are both learning. It's a big time investment that will pay off. Ask for help at home. The network support is important. Breastfeeding can be difficult at first, but it gets easier over time. Every inconvenience or difficulty has a solution. Upon request, let your baby lead and follow its hunger signs. Hunger signs. Change in breathing. Eyes move under the eyelids. Moves its arms and legs. Stretch. Brings its hands to its face or mouth. Makes suction movements. Crying is a late hunger sign. Milk production will adjust to the baby's needs. Use this chart to better understand the baby's hunger signs. There are several possible positions to breastfeed, but you do not need to use them all. Choose the positions that work best for you. In every position, the basic principles remain the same. Have an ergonomic position. Be comfortable with your back well supported. The baby's body is turned towards your breast. Its shoulders, ears, and hips form a straight line. Its belly is placed against your body. Use pillows and cushions to support the baby and the mother. Here are some examples of positions. In this position, you are half seated, slightly reclined, just enough to keep the baby from sliding down. The baby is on your belly. This position lets the baby use its reflexes to look for the breast. When the baby is in this position, it will rest his arms on the opposite side of the breasts while feeding. For example, if you are breastfeeding from the right breast, you will support the baby with the left arm. You can hold baby's upper back with your left hand, forming a cup at the base of the baby's neck. In this position, the baby is resting against the side of your body, under your arm. The upper back is supported by your hand. In this position, the mother lies on her side with her arm under her head or under the pillow, facing the baby. Her free hands hold the baby. A good latch on the breast is easier when following the basics of positioning yourself. With the tip of your nipple, touch the baby's upper lip. This will activate the baby's reflexes. It will tilt its head back, and its chin will touch your breast as it opens its mouth wide. At this point, your nipple should point to the roof of your baby's mouth. Baby then seals its mouth on the skin of the breast and starts sucking. Here are signs of a good latch. The lips are curled. The nose is free. The chin rests on the breast. A large part of the areola is in the baby's mouth. The baby's lower gum is far from the base of the nipple, and the upper lip is above the nipple or on the other side. To break the suction, simply apply light pressure on the top of the breast. This will let air in. Do not put your fingers in the corner of your baby's mouth. The frequency and duration of feedings change from one baby to the next. It is important that you understand the following concepts. The baby will feed 8 times or more per 24-hour period. It is normal for the baby to feed more often in the first few weeks. Feedings are less generous and more frequent at first, and they will become less frequent as the baby grows. Because breast milk is rapidly digested and the baby's stomach is small, in the first few weeks, do not exceed 6 hours between feedings. However, there is no maximum number of feedings. In the first 4 to 6 weeks, the milk production adjusts to the demand. which is why it is important to stimulate the breasts day or night. During the next feeding, we recommend beginning by the last breast offered or the side the baby drank the least from. It is important to let the baby finish on the first breast before offering the second one. The fat content is at its lowest when the breast is full and at its highest when it's empty. Burp the baby after each breast. Timing the feedings is useless. Observe signs of hunger and satiety. Feedings may be more frequent at certain times of the day, particularly in the evening and especially during the first few weeks. These are called cluster feedings. You can choose to switch breasts several times during a single feeding. When the baby is drinking from one breast, the other one fills up. Changes in fat concentration in the milk are directly linked to the degree of fullness in the breast. This is true during feeding, but also during the day. When the evening comes and the breast is well drained, the fat content at the beginning of the feeding could be higher than at the end of the morning feeding. This is why feedings in the evening are important. Several signs will tell you if breastfeeding is going well and if the baby is receiving enough milk. Correct positioning of the baby. Good latch of the baby. Suction motions are visible, fast and light at the beginning of the feeding, shorter and deeper when the milk starts to flow. Presence of a let-down reflex. Release of milk from the breast. You may hear the baby swallow, but sometimes you may not, even if the milk transfer is adequate. Possible sensations during the let-down reflex. Tingling, momentary pain, fullness, tension. The let-down reflex may be influenced by psychological factors. It usually happens several times during a feeding and lasts from 30 seconds to 2 minutes. The baby's appearance and behavior. The baby's general condition is good. The baby is calm and vigorous. Adequate weight gain. Adequate amount of stool and urine for its age. The mother does not feel pain and shows no injury. If you have doubts about breastfeeding, or if you have any injury or pain, it is important that you consult the resources available in your region. Sometimes a simple adjustment can greatly improve your breastfeeding experience. In the first months of life, your baby will go through very quick growth periods. The baby's appetite will increase suddenly and require more frequent feedings, sometimes every hour. These growth spurts usually last for a few days and can happen anytime during the first few months. Some babies have growth spurts more often than others do. They most often happen around 7 to 10 days old, 3 to 6 weeks old, and 3 to 4 months old. With growth spurts, it is normal that the baby drinks more during the day and night. As feedings are more frequent, the milk production will increase. Support from the relatives is especially important because these moments can be very demanding for the mother. You can breastfeed in each of these situations. For example, breast milk from the mother of a premature baby is perfectly adapted to its needs. It is different from the milk of the mother of a full-term baby. However, the support and assistance from a breastfeeding trained person is the key to success. Breastfeeding is a learning process with its struggles and successes. The first few weeks can be very challenging. It is important that you allow yourself to learn and that you ask for help if you feel the need. Breastfeeding is a natural action, but it is not necessarily innate. It requires perseverance and patience. Over time, you will have more control, and the technical aspect will make way to pleasure and relaxation. Even if the mother's diet is not perfect, breast milk contains everything the baby needs. Eat all you need. Breastfeeding leads to higher energetic needs. Drink all you need, ideally a lot of water. Have a healthy diet. Eat various types of food. Sometimes, certain foods consumed by the mother may make the baby upset or gassy. A history of food allergies in the family may be a cause, so best to avoid these foods. The mother's diet, which should include a variety of foods, will help babies develop their tastes because the milk tastes different depending on what she eats. There are particular recommendations for vegan mothers. It is recommended that you consult a professional. The amount or composition of the milk is not modified. If mom practices moderate or light intensity activities, it has no negative consequences on the newborn's growth. Train after feeding the baby, when your breasts are lighter, and wear a bra with good support. Hydrate well before, during, or after the activity. Studies show that mom's gradual weight loss, 2 kilograms per month, is better in order to avoid the release of toxins in breast milk. It is better to stop or reduce smoking. during breastfeeding, but even if you smoke, it is strongly recommended that you breastfeed your baby. The protective effect of breastfeeding outweighs the negative effects of smoking. Precautions. Do not expose the baby to smoke. Do not smoke when feeding. Smoke after feeding. Wait 2 hours before the next feeding. Tobacco may reduce breast milk production. Just as for tobacco, the advantages of breastfeeding are greater than the risks associated to a light and occasional alcohol consumption. As the baby does not have a fixed feeding schedule in the first few weeks, it would be better to avoid alcohol consumption. Here are some precautions to consider if you breastfeed and wish to consume alcohol. Breastfeed your baby just before having a drink. After having a drink, wait 2 to 3 hours before breastfeeding the baby again. The highest alcohol rate in breast milk is present from 30 to 90 minutes after drinking, depending on the presence or absence of food in the mother's stomach. Expressing the milk does not have any effect on the elimination of alcohol. Feed the baby with milk that you have expressed beforehand if you plan to have more than one drink. Alcohol quickly passes in breast milk and can reach concentrations similar to those present in the mother's plasma. Alcohol consumed in large quantities can inhibit the letdown reflex and have side effects in the baby. Cannabis and other drugs. It is strongly recommended that you do not take drugs if you are breastfeeding. Every psychoactive substance consumed can make its way into breast milk. For example, THC is found in the milk of mothers who consume cannabis. This can have effects such as lethargy or irritability on the baby. Medications. Most are compatible with breastfeeding, but it is important that you confirm it with your pharmacist. Not all newborns need a pacifier. Many will be satisfied by only sucking on the breast. However, your baby may sometimes need a pacifier for comfort, need for suction. The pacifier may also keep the child from expressing its signs of hunger. Do not use it too quickly to calm your baby. It is good to be on the watch in order to discover its real needs, food or comforting. Consequences of the inappropriate use of the pacifier. For the newborn, hides the signs of hunger, makes feedings less frequent, reduces the total amount of milk consumed. For the mother, reduces stimulation of the breasts, reduces breast milk production. It is important to start expressing milk within 6 hours of birth if the baby was not breastfed. Manual expression is more often effective than a breast pump for expressing colostrum, especially in the first 24 hours after birth. To ensure a good milk production in the first few days, extract breast milk if the baby does not feed well or if the baby refuses the breast. When the transition milk phase arrives, it is normal for the milk to separate and for the fat to make its way to the surface. Using a breast pump is not as effective as a normal physiological process seen during breastfeeding, because the simple action of taking your baby in your arms leads to your body releasing oxytocin. This is why it is important that mothers who extract their milk do skin to skin very often, ideally when they are using the breast pump. Refer to the From Tiny Tot to Toddler guide in the Handling Express Milk section to know more about how to store breast milk. Many accessories can help you during breastfeeding. None of these are essential, but they can sometimes be helpful. Nursing pads. Use pads only if the breasts leak. There are 2 types of nursing pads. Cotton, washable and reusable. Disposable, with a plastic layer that could keep moisture in and may lead to infections or thrush. They must be changed often. Breast pump. There are 2 types of breast pumps, the manual breast pumps and the electric breast pump. The double electric breast pump is more effective to stimulate milk production in the cases where the baby is unable to suck efficiently or at all, or if the mother wants to extract her milk the long term. The nipple shield is used on flat, invaginated or chaffed nipples. It can be used temporarily. Lactation aid, used to supplement the baby when waiting for a satisfactory lactation. This is done using a tube attached to a syringe with the complement. You should consult a professional before using these accessories. These are accessories used to store breast milk. Breast shells save milk that leak from the breast when the baby drinks from the other breast. Useful during the first few weeks to allow the milk production to be well established. Breastfeeding covers are used for more discretion, but can be replaced by a blanket or breastfeeding clothes. Mothers have the right to breastfeed anywhere at any time. Breastfeeding accommodations are available in communities and workplaces. A logo can help you find the location of these places. This is a protected right in the Canadian Charter of Rights and Freedoms. Feel free to ask your CLSC, perinatality nurse, or your physician for the breastfeeding resources available in your region. Info Santé 811. Website of la Ligue La Lèche. Manual breastfeeding aid group in your territory. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.